If your joints feel stiff, your back aches, and you're suddenly losing muscle tone, listen up. It's not just aging or getting old. These are direct scientific consequences of hormonal changes, and it's treatable. Welcome to my channel. My name is Shreya Kane. I'm a musculoskeletal, menopause, and chronic pain specialist, and my role is to translate complex science into actionable, evidence-based strategies for your health. Today, we're tackling the most overlooked area of menopause: musculoskeletal health, the most misdiagnosed symptoms of menopause, your musculoskeletal pain or MSK pain. The question I hear most often is, why did my pain start now? Answer is your hormones. Your joints, muscles, bones, tendons, discs, ligaments, all of it. They depend on collagen turnover, and that is impacted by estrogen. We have estrogen receptors all over. Think of muscle and estrogen as the unsung heroes of your movement system. When hormonal levels fluctuate and then decline, you lose your body's natural anti-inflammatory shield. And these changes can start happening as early as your mid-30s. The reason is perimenopause. Perimenopause can last 7 to 10 years in about 60% of the population. For 20% of the population, it'll be less than this. For the other 20% of the population, it'll be longer than the 10 years. The fluctuating and declining hormones lead to your first symptom: joint pain and stiffness. Widespread, non-specific, tendon and capsule-related pain are notorious for this. So you might have heard of frozen shoulder, when the shoulder suddenly becomes really painful, stiff, you can't sleep, and nothing relieves that pain. Or hip, knee, ankle tendinopathies, carpal tunnel, worsening back pain. This often starts occurring in midlife out of nowhere. Research is beginning to recognize clear hormonal links for this. And what we see is that inflammatory response to that natural protection. Symptom number 2, and this is so crucial for your longevity: accelerated muscle loss or sarcopenia. Estrogen directly influences muscle protein synthesis. Less estrogen means your body is less efficient in building new muscle, but estrogen also plays a modulatory role in collagen breakdown. So it acts like a supervisor that controls how much muscle is getting broken down versus how much muscle is getting built. When we're younger, the collagen production, the bone production, is much higher than the levels of it breaking down. As we go through the hormonal changes, this balance dips, and now we are breaking down more than we are building. And this further adds to the loss of protection, increasing stiffness, pain, adding stress and pressure on the joints, muscles, tendons, and ligaments. This isn't about looking young or toned. Our muscle is our metabolic currency or the savings account. Losing it puts you at higher risk of falls, injuries, and makes weight management absolutely impossible. Coupled with the hormonal fluctuations, it can really hit your metabolic health. So insulin resistance, cholesterol profiles, and mitochondrial health, which is the heart of aging and disease. Our mitochondria are the powerhouses of every cell that produce energy. The better health they are in, the better health we will experience. It's like having a great car, but not looking after the engine. Our mitochondria are the engines of our body. Symptom number 3, your lower back pain. Twice as many women report back pain than men. Loss of estrogen doesn't just impact bones and muscles, it impacts your tendons, ligaments, the quality of your disc, but your spinal cord in itself locally produces estrogen, which acts like your local, immediate, instant relief painkillers. Your spinal cord that's within your spine produces its own estrogen. This is your body's natural and instant painkiller. As overall estrogen levels decline, this declines as well, adding further to the inflammatory process, the lack of protection, muscle and bone loss, and increased pain levels. As our body experiences higher levels of inflammation, it's unable to modulate the nerve signals that are coming through from the rest of the body. Imagine them like watchmen at the gates. Only the important pain signals can come in. Your hormones at the nerve endings are like the watchmen at the gates. They carefully monitor who can come in. As the hormones are declining and fluctuating, it's like the watchmen have left their post, and anyone and everyone can come in, which then increases the pain signals coming in to the central nervous system, increases pain sensitivity, inflammation, reduces protection, and so on. And then we come to osteoporosis, the rapid bone loss. Now, it's important to remember that this is not something that happens postmenopausally, but actually starts in our perimenopausal years. It only accelerates in our postmenopausal years due to sudden decline of estrogen. The loss of bone density that happens in your perimenopausal years is the precursor to osteoporosis, and a corresponding increase in stiffness of ligaments and tendons increases your risk of common and repetitive strain injuries, strains, tears, pains, all of it. So how do we fix it? The solution is not complex, but it must be precise and evidence-based. My approach is threefold, with a huge focus on science-backed lifestyle strategies because it's a low-cost tool, it's backed by science, and has no side effects. Number one, protein. You need much more protein than you think because every cellular process and every structure from your hair to your toenail needs protein. We need protein for muscle, bones, tendons, ligaments, joints, discs, neurotransmitters, hair, skin, hearing, all of it. Research currently recommends aiming for between 1.6 to 2.2 grams of protein per kilo of ideal body weight. Remember, this is research. You have to trial and error with your body to find what works best for you. It's also important that it is spread out strategically, and having protein first thing in the morning is crucial. Protein fuels muscle repair through providing building blocks for collagen, critical for your muscle and skeletal health as well as your skin and hair. This links directly with the work I do in regenerative aesthetic medicine, and I always say you can't fix tissue quality externally if you're not building it internally. What glows on the inside shows on the outside. Number two, the correct movement. Forget about endless cardio. The single best investment in your menopausal body is resistance training, building muscle. Muscle is the organ of longevity. There's nothing that will bring down inflammation and dispose glucose out of your bloodstream as muscle does. This is a non-negotiable for your muscle health, skeletal health, movement, longevity, not just for living longer, but living better, because we know women live longer, but we live in poorer health. Low-grade inflammation is the root of musculoskeletal pain. When you're muscle training, you need to create a load that signals your bones to grow. My neurodiversity allows me to spot the connection between pain, musculoskeletal health, and create novel strategies that work for you in real time. Forest bathing, spending time in nature, being mindful of your auditory environment. These are research-backed, powerful tools proven to be effective to reduce your systemic stress. So what's the big takeaway? Your joint pain is a message. It's a signal that your body requires hormonal and nutritional and activity modification. Do not accept the just getting old narrative. Do not accept to live in pain just because you're getting old. I urge you to use the knowledge from this video to have an informed conversation with your GP or your healthcare provider about hormone replacement therapy and incorporate these science-backed lifestyle strategy tools into your life, one at a time, so that your nervous system does not feel overwhelmed. If you're interested in diving deeper into this area, specifically your musculoskeletal health, pain, and regenerative aesthetics, how this impacts women from different ethnicities and the South Asian communities, make sure you're subscribed. Your tissue quality, skin, and collagen is fundamentally linked to these hormonal and muscle and skeletal changes. If you want to know how a regenerative approach can support your skin and longevity, you can find a consultation link below. Thank you for joining me, and please hit the like button if you found this valuable and leave any questions in the comments below. I'll see you in the next video.